Hi everybody, welcome to Dr. Manny's YouTube Learnshops. This is a session that deals with behavioural sciences, attitudes and human behaviour. The learning objectives or outcomes for this session are basically that you should be able to define what behavioural attitudes are. Explain certain selected theories for why we have the attitudes within our behaviours, and to be able to describe how to persuade individuals to change their behaviour, which might be really important if you're a nurse and you're in a clinical practice and you've got patients that now have got unacceptable behaviours which affect their health. Also to be able to explain methods for changing those health behaviours. Okay, what are attitudes? Think about it. By definition, an attitude is a positive, favourable, or a negative or unfavourable evaluation to a reaction towards something or someone that's exhibited in your beliefs, thoughts, feelings, and behaviours. Simply, it's just a way of feeling or acting towards a person, a thing, or a situation. For example, you can be passionate about a sport, not me. You can dislike certain foods. You can be negative towards life in general. They're all examples of attitude. And they summarise a person's intellectual view about their ideas, objects, people, opinions, feelings, beliefs, evaluations, and even prejudices. One of the models that looks at attitudes is called the ABC model for attitude. Remember this. A is for affective. It's about your feelings. B is behavioural. It's what you do. It's how you act. They're social actions. C is cognitive. It's about how you think. Your reasoning, your knowledge, and your beliefs. Affective, feelings, behavioural, social actions, cognitive, reasoning, knowledge, and beliefs. These all create your attitude. So the components of attitude then are cognitive. What a person believes about the object, source of their attitude. Affective. How the person feels about the object. That's the source of the attitude. Then you've got behavioural. How the person acts towards the object or source of that attitude. So cognitive is about reasoning, what the person believes. Affective, it's about emotions, how the person feels about it. Behavioural is how they act. So what's the purpose of the attitudes if we're using the ABC model? Well, the cognitive, the reasoning, it evaluates the object so that we can tell whether it's good or bad, whether it's useful or not useful, whether it's worthwhile. The affective or the emotional is based on a variety of objects. This is to do with values. This could be moral, ethical, religious. Sensory actions. Well, look, what food do you prefer? And it's related to conditioning, which we'll be looking at after. Then you've got the behavioural or the social actions. And this reveals a person's actions. For example, to a baby. Everybody loves babies, do they? to a smoker. Nobody likes smokers. Well, gee, a lot of people smoke. Sickness. Different ethnic groups. Different religious groups. So the purpose of attitudes are cognitive, to evaluate. Affective, which is related to emotions. And behavioural, which is about actions. What are some of the characteristics that are related to attitudes? Well, attitudes are not quantitative. They don't fit into a numerical scale. They're difficult to measure. They're subjective. However, attitudes, the characteristics related to the attitudes, are demonstrated by how a person behaves. And as we mentioned previously, once formed, they're not easily changed, especially if we compare it to the plasticity theory. So you can have attitudes that can be classified with positive or negative implications. You can have a positive attitude, you can have a negative attitude, or you can have a combination of both, which neutralizes both. What are the influences related to attitudes? Well, if you've got a positive, valued attitude, it's more likely that you're going to achieve what you want to achieve, whether they're personal or whether they're professional goals. If you've got a negative attitude, you're probably going to be an unhappy person. And by being an unhappy person, you might find it very difficult to achieve what you want to achieve in your life. So it's better to promote a positive attitude rather than a negative attitude. And think about that as well. As you go through this 4-year program, which would you prefer? A nurse like that, or a nurse like that? Which would you prefer? A patient like that, or a patient like that? Positive versus negative. This is a famous Australian tennis player called John Newcombe. And he had a very important quote, which I've employed in this session. And he said that the strongest and most dangerous enemy that a person will ever face is a negative attitude. And he suggested, learn to recognize it when it's trying to invade your body and your mind. And it will. You will. You'll encounter times during this course and in your life when you'll have a negative attitude. And you'll think, is it simply worthwhile going on? But be positive and simply refuse it to enter you. Talk to somebody. Talk to your mentor. Talk to your mother, your father, your sister, your brother, someone you trust. What's the value of positive attitudes? Well, a person with a positive attitude is typically self-motivated. They're a team player. They're cooperative and happy. They're respectful. They're optimistic. They're pleasant, they're flexible, and they certainly are health conscious. They try and be friendly. They're punctual. They're committed to what they do. They're confident, decent, peaceable, kind, honest, and receptive. These are some of the value positive attitudes that we all have. What are the consequences then of a positive attitude? And always put it in the context of being a human being, or you can put it in the context of being a nurse. The consequences are that if you have a positive attitude, that you're typically happy. You're a happy person. And this promotes patient safety. It fosters a team spirit and working together. And as a consequence of that, people are happier and you've got an improved morale. There are feelings of confidence, and as a nurse, you'll provide a high quality service, which is what your patient wants. And what does it do for the nursing profession? It enhances their reputation. Look at what happened during the COVID-19 pandemic, which is still ongoing. Certainly here in Malaysia and in certain other countries where nursing wasn't quite as valued as other medical or paramedical professions, it certainly gained more prominence. And if you have a positive attitude, communication is typically better. What about negative attitude? Just reverse it. If you have a bad or a negative attitude, you're not respectful. You're not a team player. You're always moaning and groaning about everything. You're typically pessimistic and unhappy. You're an unpleasant person to be around, really. Everything has got a negative connotation to it. You're typically sarcastic, inflexible, and you question authority, and as a consequence of that, you're insubordinate. You'd rather moan than offer for a solution. You're not on time, you're gossiping, you're always watching the clock. Is it time to go? Your patients will notice that. You're defensive, you're argumentative, you're disruptive, you're rude and confrontational. When someone's offering you advice, you don't take it. Well, you certainly don't listen to it. What are the consequences of a negative attitude? Well, typically you're an unhappy person. It's really sad. And as a consequence of that, it'll affect your patient. And there will be safety issues. Maybe there'll be medication errors. Maybe you won't identify the patient correctly and they'll have the wrong procedure. Team spirit, well, there isn't any. Morale declines. There's a poor quality of service. The nursing profession's reputation suffers. There's poor communication. Everybody's feelings get hurt more easily. No one wants to be around a person with a negative attitude. When we look at theories related to attitudes, there are numerous. But the ones that we're going to look at are the most commonly used. Now, the functional theory of attitudes was proposed by a fellow by the name of Daniel Katz in 1960. And he takes the view that attitudes are determined by the functions they serve for us. People hold given attitudes because these attitudes help them to achieve their basic goals. Now, Katz was an American psychologist, a professor. And his point was that people have particular attitudes because these attitudes help them achieve their objectives. And when an attitude changes, it's because it no longer serves a function. And the function has to be practical. or by changing a person's underlying motivational and personality needs. So basically, an attitude is there to serve a purpose, and it will change if you no longer need it to serve that purpose. Now, the functional theory of his attitude was basically 4 components. And the 4 components were the utilitarian function, which is related to rewards and punishments. The value-expressive function, which expresses the person who's using it or the consumer's values or self-concept. Ego-defensive. The ego-defensive function is just to protect ourselves from external threats or internal feelings. Not physical, this is emotional. Then you've got the knowledge function, where there's a need for order or structure or meaning to why the attitude is there. Attitudes exist because they serve some sort of adaptive function. Now, knowledge function, this is to do with attitudes providing meaningful, structured environments. In life, we all seek some degree of order, routine, clarity, stability in our personal frame of reference. So the knowledge function is about structure, and it helps people realize or ascribe reasons to why events or situations that are occurring with them, and they use those to make sense for them. It helps to make the world more understandable, predictable, knowledgeable. Knowing a person's attitude helps predict their behaviour. An example that I've taken, for example, is in the absence of knowledge about a religion. You don't know about the religion, the person's culture, or the person who has that religion or culture. People may use a stereotyped attitude for judging that person. So people who are not familiar, for example, with the concept of Islam may stereotype Muslims unjustly, which happens around the world constantly. And as a consequence of that, the Muslims who are innocent are suffering. The next one is value-expressive function. And this is about expressing basic values, and it reinforces your self-image. So for example, if you view yourself as a Catholic religion, you can reinforce the image by adopting certain Catholic beliefs and values. The cross. A lot of Catholics hang a cross around their neck, in their car, in their home. So the value-expressive function is the role of an attitude and how it can play in the expression of those core values that the person believes in. Core values, they tend to establish our identity, they give us social approval, and thereby presenting who we are and what we stand for, or who we advocate for. A function of attitudes that allows a person to express their self-confidence, self-image to others. So for example, a person might adopt a negative attitude to recreational drugs, drinking alcohol, smoking cigarettes, because they're associated with health issues and values. Then you've got the ego defensive function. Now, some attitudes in this group here They serve to protect us. They protect us from acknowledging basic truths about ourselves or the harsh realities of life, and their defense mechanisms. For example, those of us with feelings of inferiority may absolutely develop an attitude of superiority. So you can be feeling very insecure about yourself and think that you're superior to other people. Look at bullies. Bullies pick on other people, whether it's physical or emotional, because they have their own problems. So the ego defensive function refers to holding attitudes that protect, they defend our self-esteem, our self-importance, which is our ego. Or they justify actions that make us feel guilty. And these involve psychoanalytic principles where people use defense mechanisms to protect themselves from any psychological harm. And the mechanisms include denial. No, it didn't happen. Repression. Just don't think about it. Projection. Put it onto somebody else. And rationalization. Make sense of it. So, for example, you'll see this when you go to the clinical areas. As a clinical instructor whose teaching is questioned by you, a student nurse, they may feel threatened. The clinical instructor, look, she's old. She hasn't followed evidence-based practice. She may constantly give you incorrect information, but the clinical instructor isn't going to admit this, not to you. You're a student. And they will try and protect their ego by scolding you and telling you to be quiet and listen. Then you've got the utilitarian adjustments function. And this is where we develop attitudes towards things that aid or reward us. Sometimes this is referred to as instrumental. And what we want to do is we want to maximize the rewards and minimize the penalties. So, the adjustment function or the instrumental function or the utilitarian function directs people towards pleasurable or rewarding objects and away from unpleasant ones. It's a practical concept of maximizing reward and minimizing punishment. So, for example, you guys, when students are supported, they're more likely to develop a positive attitude. If they're supported by their parents, by their clinical instructors, by their lecturers, they have a positive attitude towards their education and lecturers. When the students are criticised and given minimal support, they're more likely to develop a negative attitude towards their education, towards their lecturers, towards everything. Rewards are more beneficial than punishment. Attitudes. How are they formed? Well, an attitude, we said, basically it's an enduring set of emotions, ongoing. They're beliefs about a particular object, person, organisation, issue, event, and they're formed over time as we're exposed to stimuli and we make an evaluation. So attitudes are formed by conditioning, modelling, and cognitive learning. Thinking. With conditioning, you've got classical conditioning, which is passive, which we'll be discussing. You've got operant conditioning, which is related to rewards and punishment. And then you've got conditioning that comes from your socialization, from your family, from your culture, from your peers, from your schooling. You've got modelling. And modelling, it's a powerful tool for passing on knowledge, skills and values. And typically, role modelling or modelling is watching others. And we learn from them because we trust them and we respect them. Or you can see it from your peer group or the reference groups that you socialise with. With cognitive learning, you're problem solving. And this is where you reach logical conclusions based on knowledge or information, based on your experiences. Well, what's socialization then? Socialization is the process through which people become part of their society. It's how they're integrated into that society by exposure to actions and the opinions of others. And the most important socialization agent is the family, especially in the early years, which we indicated earlier on in another session. Then you've got peer groups. Peer groups are people of your own age. And peer groups have got a very powerful influence on your attitude and how it forms, especially during adolescence, when you're going from puberty to adulthood. And this influence is stronger, according to the research, than parents, teachers, or other role models that were previously considered in your adult group. Then you've got reference groups. And reference groups are people that you share a common interest with. And this is because you tend to influence each other and your behaviour. And these are even more influential in your peer groups as you start becoming older and you get into young adulthood. Role modelling. Role model identification. A role model is someone that you admire, someone that you respect, or someone that you're likely to copy or emulate. Typically, parents and relatives are most important in your early years. Then, from the media, radio, TV, movies. And then teachers. Teachers in relation to your schoolwork or things that you're learning. Teacher doesn't have to be at school. Teacher can be in the home. Teacher can be in your playgroup. Teacher could be in your reference group. Then you've got cultural influences. And you're well aware of what I'm talking about in a multicultural society like Malaysia. And cultural influences, this is about the total of your knowledge, beliefs, values, customs that we use to adapt to our environment. And people define themselves depending on their culture. You can be a Muslim. You can be a Hindu. You can be a Christian. You can be black, white, yellow, according to your race. Cultural influences are very important in the formation of attitudes. Then you've got rewards and punishments. And rewards and punishments, this is where attitudes are developed to minimize punishment and maximize rewards. And they're used to encourage or discourage certain attitudes. Okay? Here's a question for you to think about. Does behaviour, the way you act, affect attitude? Or does attitude affect behaviour? And this is a difficult question. The experts or the academics often associated with the question, which one came first, the egg or the chicken? The chicken or the egg? And academic Meyer, in 2002, he stated, attitudes can predict our behaviour, and behaviour or action can affect or mould our attitudes through prescribed social roles which mould the attitude of the role player. Both attitude and behaviour generate each other. So they work together. None came first. Behaviour didn't affect attitude, and attitude didn't affect behaviour. According to Meyer, they work together. They're synonymous. Another model that relates to attitudes and behaviour is the Betari box model, sometimes referred to as the Betari Conflict box model, because this is where attitudes and behaviours are linked. So if you look at the diagram, it says your attitude affects your behaviour. Your behaviour affects my attitude. My attitude affects my behaviour, and my behaviour affects your attitude. It's cyclic. No one actually knows where this originated from, but as I said, the name comes from a Persian city of Betari, located in Iran. Iran was Persian. Have a look at the images. Your behaviour, my behaviour, may affect your attitude. Your attitude may affect my behaviour. So have a look at this. My attitude affects my behaviour, which affects your attitude, which can be seen as being positive. However, my attitude affects my behaviour, and my behaviour affects your attitude. Okay, let's review the two main types of conditioning. You've got affectively or feeling-based attitudes. This is classical conditioning. And classical conditioning is also known as Pavlovian or respondent conditioning. And it refers to learning a procedure in which there's a biologically potent stimulus, like for example food, and it's paired with a previously neutral stimulus such as a bell. Pavlov's dog experiment, which we'll be looking at as we go through. In classical conditioning, this is where you've got a stimulus that produces an emotional response, and it's repeatedly experienced with a neutral stimulus. And it's the neutral stimulus that doesn't initially produce an emotional response, but it does when it takes on the properties of the first stimulus. So for example, stimulus 1, mothballs. Mothballs are used to discourage moths or bugs in clothes. Camphor. Old people, certainly from my generation here, always smelled of mothballs because their clothes were always with mothballs to discourage bugs going in there. So they always smelled of it. This little kid goes to visit his grandmother and she always smells of mothballs. And he becomes associated with the fact that the camphor smell of mothballs is always with his grandmother. So after being repeatedly paired, stimulus 1 and stimulus 2, mothballs grandmother, mothball grandmother, mothball grandmother, the kid doesn't need the stimulus 2. Stimulus 1, the mothballs, produces feelings of pleasure, meaning that every time the kid smells the mothballs, he remembers his grandmother, and it makes him happy because she was always good to him. She always cared about him. It makes him happy. Then you've got operant conditioning. And operant conditioning, this is a method of learning that occurs because of rewards and punishments for a behaviour. And it was Skinner in 1938 who stated that an individual makes an association with a particular behaviour and a consequence. So if you do something and you're rewarded for it, you're more likely to do it again. If you do something and you're punished for it, you're more likely not to do it again. So, if we look at it, it refers to behaviours that people freely choose to perform. The behaviours increase or decrease in frequency depending on whether they're followed by rewards, positive reinforcement, or punishment, negative reinforcement. Look at the two children playing together. In a multicultural society, this is acceptable. I can tell you there were times, and still are times, where black and white, coloured, white, unacceptable behaviour, which we'll be covering as we go through this course and other courses like social sciences or social sciences and health, which you'll cover in semester 2 and semester 3. So have a look. Playing with a child of another race. If you get positive reinforcement, parents say, oh, that's cool, no problem. If the parents say, no, don't do it. As a consequence of that, positive or negative attitude will affect that attitude towards the behaviour. Operant conditioning. When we look at classical conditioning, the founder was Ivan Petrovich Pavlov, who was a Russian physiologist. And he basically stated that it's passive learning associated to a stimulus which produces a new learned response or behaviour in a person or an animal. And the influence of classical conditioning can be seen in responses such as phobias, being disgusted, nausea, anger, racism, sexual arousal. Classical conditioning helps us adapt to our environment. This is Pavlov's dog study in the early 1900s. He showed how classical conditioning could be used to make a dog salivate just by ringing a bell. Before the conditioning, the unconditioned stimulus, the food, the dog was shown the food, they were hungry, they started to salivate. This was before the conditioning. Then, still before the conditioning, Pavlov got a tuning fork and made a noise. This is a neutral stimulus. It's got nothing to do with the food or the salivation. He rang the bell or the tuning fork and nothing happened. There was no salivation, no conditioned response. Nothing happened. Well, why would a bell or a tuning fork make you salivate? Then during the conditioning process, he combined the two. He showed the dog the food, was hungry. He rang the bell or the tuning fork, and the response was salivation. Not because of the tuning fork, but because of the food. The salivation was the unconditioned response, because again it was associated with food. Then after repeated associations, food, tuning fork, he just had to ring the bell or the tuning fork and the dog started to salivate. Because this was a conditioned response. Here are some other examples of classical conditioning. Have a look. The neutral response is the unconditioned stimulus. That's lightning. Then, not long after, boom, there's thunder. This is the neutral, unconditioned stimulus. The response typically that people have in relation to thunder, not lightning, is they get a startled reaction. I mean, lightning doesn't make you jump. It's the thunder, the boom, the unconditioned response that gives you that reaction. After repeated exposures to it, you know that lightning is followed by thunder, and it will be loud. So, after repeated conditioning, when we see the lightning, we anticipate that there's going to be a loud noise. So the conditioned stimulus, we've seen the lightning, and then we expect there to be thunder, which could be really, really loud and make us jump. Classical conditioning. Another example. The neutral stimulus is a white rat. The baby, there's no response. However, go to 2, then there's a loud noise. The unconditioned stimulus. It makes the baby jump. Unconditioned response. Then when you combine the loud noise and the white rat, the unconditioned stimulus with the neutral stimulus, the baby jumps because it's scared. Not because of the rat, but because of the noise, the unexpected noise. After repeated associations, noise, rat, cry, noise, rat, cry, noise, rat, cry, the kid just has to see the white rat and he starts to cry. This is a conditioned stimulus. Now, here's just a bit of a joke. Watch what I can make Pavlov do as soon as I drool. He'll smile and he's right, and he'll write in his little book. Then you've got operant conditioning, which was first described by Boris Francis Skinner in 1938. And he was an American psychologist. And he focused on strengthening or weakening voluntary behaviours and applied reinforcement or punishment after that behaviour. And he stated this required the learner to actively participate and perform in some type of action in order to be rewarded or punishment. Unlike classical conditioning, which is passive. It's a passive form of behaviour learning. Operant conditioning is active. So, in operant conditioning, he had 4 quadrants. The basic principles involved what happens after the behaviour or the consequences in order to modify the behaviour. And he stated that behaviour has got a positive or a negative consequence. And reinforcement increases the strength of that behaviour. Punishment decreases the strength of the behaviour. Reward increases the behaviour. And you note it's the behaviour that's reinforced or punishment. To decrease the behaviour, you add a positive punishment. To increase the behaviour, you add a positive reinforcement. To remove or decrease the behaviour, you add a negative punishment. To remove or increase the behaviour, you provide negative reinforcement. So have a look. This is operant conditioning. If you want the kid to clean his room, increase the behaviour, reinforcement. Look, clean your room, kid, and mummy will be very, very happy. However, to positively reinforce it, the kid gets paid. Here, okay, you cleaned your room, good boy, here's a few ringgit for you. However, if they don't, there's a punishment. No reward. Then you've got operant conditioning. The room's messy. Very, very messy. Punishment? Go to your room. Time out. No money. No reward. Operant conditioning is related to rewards and punishment. Rewards reinforce the behaviour. Punishment decreases the behaviour. Here's an example of operant conditioning. Someone's bringing something, a present, to the female. It's being observed. Why, thank you for the delicious orange, Robert. That deserves a little kiss. Being observed. The other guy brings a bucket full, a trolley full, a crate full of oranges. The person or the animal learns the behaviour has got consequences. My daughter has just acquired a little toy poodle. Beautiful little dog. But she defecates, poops, pees, barasses, whatever terminology that you want to use, outside, in the wrong places. So, to reinforce the behaviour, operant conditioning, she's punished. She's shown her feces very closely, not in her face. She's given a slight smack on the behind, not very hard, and she doesn't like it. She's taken to her litter box and placed there and told, this is where you go, good girl, and she gets a pat. She now, even though she's only 2 months old, goes to her litter box after understanding this is where she has to go. Skinner's rat study was actually the initiator. And this is where Skinner, 1938, used an operant conditioning chamber known as the lever box to teach the rat to push a lever. The action of pressing the lever is the operant response or behaviour, and food is released inside the chamber as a reward. The positive reinforcement is pressing the lever and they're given food. The negative reinforcement was pressing the lever to turn off the shock, because in this study here there were a loudspeaker, lights, an electrified grid, a food dispenser and a lever. And he did several different experiments using this. But operant conditioning basically is learning that occurs through rewards and punishments for a particular behaviour. Look, learning to eat. The learner might begin by picking up a spoon, scoop the food onto the spoon, lift the spoon out of the bowl, put the spoon in their mouth. If their parents praise the infant, it reinforces the learning. If they make a bit of a mess here and their parents scold them, then criticism from the parents or the siblings or the teacher impairs learning. Learning to write. The learner might begin by tracing letters, connecting the dots, copying letters, writing letters from memory. If the teacher praises and the parents reinforce it by praising them, then learning is positive and it reinforces the learning. If the teacher says, wow, terrible, wow, shocking colouring, and the parents say, oh my God, what shocking, this will impair learning. This will discourage writing. Praise, not criticism. Which type of conditioning do you think is happening here? You've got little Terrell, he smiles. His father picks up Terrell. Terrell keeps smiling. What sort of reinforcement is in this picture? The father positively reinforces his son's happiness by picking him up. The infant positively reinforces his father's action when he's picked up and keeps smiling. So both father and son benefit. This is operant conditioning. Okay, have a look at this. Oh gee, I've experienced this myself. Which type of conditioning? Mary orders fish sticks for dinner in a restaurant. After eating them, she becomes nauseated and she vomits. The neutral stimulus or the unconditioned stimulus are the fish sticks. The unconditioned response is that she becomes nauseated and vomits. Now, and look, I mean, even though it's meant to be repetitive, it may only need to happen once. I can certainly identify that. Now, whenever she sees or smells fish sticks, she becomes nauseated and starts to gag. Fish sticks, the conditioned stimulus associated with the nausea, and she starts to vomit or gags, the conditioned response. This is classical conditioning. Which type of conditioning is this? What's the reinforcement in this cartoon? Kid screaming. Mother shoves a candy bar into its mouth. The child negatively reinforces his mother when he stops crying because he gets what he wants. His mother positively reinforces his cries by giving him the candy. The kid cries. Every time the kid cries, mother shoves a candy bar in his mouth. This is operant conditioning. Which type of conditioning is this? Your 7-year-old daughter is having her vaccinations. The nurse says, learn from this, this will not hurt. But it does. It's really painful. And it upsets little 7-year-old very much. The neutral stimulus or the unconditioned response. Now she has to see the dentist for the first time. And he says, oh look, don't worry Mary, or whatever her name is, this will not hurt. conditioned stimulus, which immediately, as soon as he says this will not hurt, this immediately makes her upset and scared. Because this was said to her before, and it did hurt. This is the conditioned response. This is classical conditioning. So, if you're going to do something to a patient, tell them the truth. This is going to hurt a little bit. It's a needle. Of course it will. But it won't hurt for that long thereafter. Which type of conditioning is this? Look at the reinforcement. I'll have to wake up crying in the middle of the night more often. The child was crying. The child negatively reinforces her parents when she stops crying because she gets what she wants. So she was crying in her room. The parents went and got her, put her in their bed. Her parents positively reinforced her cries by letting her sleep with them. So every time she cries now, the parents go and get her and put her in the bed and she stops crying. This is operant conditioning. She's rewarded for a behaviour that is unacceptable in certain cultures. Which type of conditioning is this? John's 15 years old. Both John's mother and father drink alcohol every night. They tell John that drinking alcohol is very, very bad. John goes to a party where alcohol is served. Will John drink alcohol? Think about it. Yes or no? Why do you think that? What sort of reinforcement is that? John's parents positively reinforce that alcohol is okay to drink. He watches them do it every night. Therefore, he's more likely to drink alcohol at the party because he's seen his parents drinking regularly. Conditioning, this is operant. And as we indicated earlier, people, children, are more often likely to follow role models. It doesn't matter that his parents said, alcohol's really bad, John. He sees his parents doing it, which reinforces the behaviour, and he's probably more likely to do it. To drink alcohol, to smoke, to take drugs, to do the wrong thing. Because he's seen other role models do it. And just because they've said that it's bad, well, if it's bad, why are they doing it? There are certain attitude change theories. We're just going to look at some of them. You've got the theory of persuasive communication. Persuasive communication is the action or process of convincing someone or of being influenced to do or believe something. And these are messages that are aimed at subtly, gently, changing the attitudes of the receivers. The key role of persuasive communication is to encourage others to understand the viewpoint and agree with you. Getting a child to take medication is sometimes really, really difficult. Okay, according to persuasion theory, there are certain types of persuasion. And the types of persuasion typically consist of ethos, logos, or pathos. This is all Greek. Ethos uses morality and ethics. And this is to convince the person or people of their goodwill and present themselves as being trustworthy. Trustworthy persuasion. Trust me. Believe what I say. Logos uses logic or reasoning and rationality to convince the person or people of their viewpoints. It makes sense to do that. There's a reason why we do that. Pathos uses emotions to present viewpoints such as love, fear, empathy, anger, to influence the emotions of the person or the people of their viewpoints. They get angry. You've got to do it, okay? Because I say that it's important that you do this. Or, sweetheart, please do it for Mummy, because you love Mummy. Okay? Mummy would never do anything here to harm you because I love you. The key elements to persuasion are who, the sender, the message says what, the channel or the medium, the receiver, and the effect. So, you've got the communicator, which could be ethos, logos, or pathos. The message, who's delivering that message, who's receiving that message, and what effect does it have. These are the key elements related to persuasion theory. So, for example, you as a healthcare professional, let's look at health issues. You're the healthcare professional, you're the nurse. Your message is, look, cigarette smoking is harmful. This can come through the television, the radio, newspapers, forms of media. Who's it going out to? The public. What's the typical effect? Well, the hopeful effect is that smoking declines. This can be related to all healthcare issues. Then you've got the theory of planned behaviour. And the theory of planned behaviour is that the attitude is towards the behaviour and subjective non-measurable norms and perceived behavioural control. And together these shape an individual's behavioural intentions and their behaviours. So, for example, an attitude towards the behaviour. Oh yeah, look, I believe in physical fitness. The subjective norms are, look, I've seen my colleagues, my neighbours, and they seem to be jogging and going to the gym all the time. The perceived control is, I can do this as well. I believe in physical fitness, other people do it, therefore if they do it, I can do it as well. So the behavioural intention is, I'm going to start this next week. And that revolves into a behaviour. Then you've got the theory of cognitive dissonance. And this theory states that people will try to maintain consistency among their beliefs and make changes when it doesn't occur. So, for example, the attitude is changed because of conflict amongst their beliefs. Dissonance is conflict. Cognitive dissonance theory was generated by Leon Festinger, who was a psychologist. And he first described it, conflict theory, or cognitive dissonance, and he stated that individuals seek consistency. They want stability in relations to the way they think or their beliefs. And when there's conflict or confusion between their attitudes or behaviours, something has to change to remove that conflict. And his focus was on changing behaviours will lead to a change in attitudes. So for example, look at the cartoon. People are motivated to seek consistency between their beliefs, feelings and actions to reduce the conflict in their mind, the cognitive dissonance. So have a look. Why should I hire you as my consultant? Well, I'll use my special process of cognitive dissonance to improve employee morale. The employer states, well, how does it work? Well, when people are in an absurd or stupid situation, their minds rationalise it by inventing a comfortable illusion. Okay, I'll go do it. So the new employee goes up to an employee that's already been working there. Isn't it strange that you have this dead-end job when you're twice as smart as your boss? The hours are long, the pay is terrible, no one respects your contributions, and yet you freely choose to work here. He states, this is crazy, this is stupid. No, wait. There must be a reason. I work here because I love the work. No, I love this job. So even though he's being paid a very small amount of money, the hours being very, very long, no one actually respects what he does. However, he wants to work there. So he rationalises it by saying, well, look, I know I don't get paid much, no one respects me, the hours are long, but I love the work. People are motivated to seek consistency between their beliefs, feelings and actions to reduce any conflict that might be associated with what they do. Again, people don't want the truth. People want comforting lies. Because it makes them feel better. It makes them feel better about their conflict. They don't want unpleasant truths that smoking will cause cancer. They want comforting lies that says, gee, there's very little evidence that supports this. Or, my father smoked till he was 110 and it never hurt him. Cognitive or dissonant cognitions are related to these. These are examples. The attitude. I enjoy smoking cigarettes. The behaviour. I smoke 30 cigarettes a day. The cognition. Smoking cigarettes is unhealthy. That's one viewpoint. There's a strong attitude and it will have a very strong influence on the person's behaviour. Have a look at this. Think about it. Stop smoking, lung cancer kills. Does this sign really work? Smoker's lung, healthy lung. Do these images really work? Look at the cigarette packets. And they all have it. Whether it's in America, Australia, Malaysia, China, they're there. Smoking causes blindness. Smoking causes mouth and throat cancer. Don't let your children breathe your smoke. It will hurt them. Does this really work? Just go out into the community and see all the people smoking. People smoking in their car, blowing the cigarette smoke at their children in the car. Does it really work? Reducing dissonance, number 1. The attitude, I enjoy smoking cigarettes. The cognition, smoking cigarettes isn't really unhealthy, and they continue to smoke cigarettes. To reduce the conflict or the dissonance, the people smoking find new information such as, well, research hasn't really proven that smoking is definitely unhealthy. Then you've got reducing the conflict, number 2. I enjoy smoking cigarettes. Smoking cigarettes is unhealthy, and they stop smoking cigarettes. To reduce the dissonance, they find new information such as research has proven that smoking is definitely unhealthy. Reducing conflict, number 3. I enjoy smoking cigarettes. Cigarette smoking is unhealthy, but they continue to smoke cigarettes. To reduce the dissonance, they justify or rationalise their behaviour with an attitude that advocates a live for the moment. Oh look, I'm going to keep smoking. You can't live forever anyway. Or they continue smoking because my father smoked till he was 80 and he was okay. Reducing conflict or dissonance, number 4. I enjoy smoking cigarettes. Smoking cigarettes is not unhealthy, and they continue to smoke cigarettes. To reduce the dissonance, they make fun of or ridicule the message or the messenger with an attitude that advocates, what a load of rubbish. I don't believe what they say. So in contrast, you can have an attitude like that will not be important to a person if it doesn't relate to their life. So for example, people enjoy smoking cigarettes. I do not smoke cigarettes. It's not my problem. Everybody else can smoke as much as they like as long as it doesn't affect me. Okay, let's have a look at this, just to break it up a little bit. Do attitudes determine or predict behaviour? This is a very interesting experiment that was done in 1971 called the Stanford Prison Experiment. And this was a landmark psychological study on human response to captivity, in particular to the real-world circumstances of prison life. It was conducted in 1971 by Professor Philip Zimbardo of Stanford University. And it was a social psychology study in which college students, and they were all friends. One group became prisoners and one group became prison guards in a simulated prison experiment, in a simulated prison environment. However, mistreatment of the prisoners, the students, escalated so badly that the principal investigator stopped the experiment only after 6 days. So, do attitudes determine or predict behaviour? This was the Holocaust, Second World War. Human behaviour. The Nazis in Germany, Second World War, murdered approximately 7 million Jews because of their race, their beliefs. Do attitudes determine or predict behaviour? The African American atrocities. Just look at what happened in 2019 in America. 2020 ongoing. Do attitudes determine and predict behaviour? The question again, does behaviour affect attitude or does attitude affect behaviour? Think about it. Then we have self-perception theory. And self-perception theory is about attitudes not causing behaviour. Behaviour causes attitudes. That's the belief. People do not experience a negative state called dissonance. This theory refutes that. People simply judge their attitudes from their own behaviour in the same way that an observer might. People often attribute behaviour to a person's traits or attitudes. So when we're unsure about our attitudes, we infer or push them onto someone who's observing them. For example, people examine their behaviours and ask, why did they do that? So for example, if you witness a child scowling at her mother, you might infer that she is upset or angry with her mum. If you saw someone in a park recycling a plastic water bottle rather than throwing it in the garbage, you might infer or think that the individual is concerned about the environment. This is some advice for you to consider as a nurse or as a human being to improve your attitude. Smile more. It's body language. Always work with a purpose. Push yourself past your limits every day. Be optimistic. Avoid negative people. Use setbacks or failures to improve your skills. A failure, if you look at it positively, isn't a failure. It's called experience. Hopefully, you won't fail again. Hopefully, you'll have a positive experience. Seek out those people who have a positive attitude. Avoid the negative. And don't take yourself too seriously. And forgive yourself. Forgive yourself for your limitations or your failures, if you want to call them that. And say thank you to people. Thank you seems to be really hard for people in this country to say. Really, from my perception. And when you do say it, people are often shocked because they often don't hear it enough. A simple rule that I suggest you remember is when your experience is followed by a positive outcome, a person is likely to repeat that behaviour. When an experience is followed by a negative outcome, the behaviour should soon stop. So in summary, attitudes are acquired through early childhood socialization, peer and reference groups, rewards and punishment, absolutely role model identification, and cultural influences. Individuals, you have got the power to choose your attitudes. Employers, and you'll all be doing this in the future, hire and retain people who care, are self-motivated, are self-directed learners, are willing team players, are concerned about their own health and wellness, value co-worker diversity. So a final word then is, changing an attitude can be a challenge. Change is part of a continued growth and success process. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Learnshops on YouTube. Okay, bye for now.